Hi, I am Dr. Alessio, and we are going to go over the topic of cataract surgery. There are two important questions that I go through with every patient when trying to decide whether or not to proceed with any elective cataract surgery. The first question is really one for you, the patient, to answer. That question is, are you unhappy with the quality of your vision enough that you're willing to have a surgery that's safe but not free of risk in order to maximize your potential vision? If in fact that is the case, then it is my job to tell you whether or not I think doing the surgery would likely improve your vision. What that depends on is the health of the rest of your eye. So today you are going to have a complete eye exam, and we are going to review the complete health of your eye with you, along with the risks and benefits and alternatives to cataract surgery, which we will show you next.
I had problems at night in terms of driving at night, but I was also having problems just generally driving. I drive a lot, part of the job that I have, and it was bothering me, and I really felt like I needed to do something. And I was having problems reading, frankly. I wasn't enjoying reading.
When I noticed that my vision was deteriorating and it started to really bother me, it was driving at night, reading, being at the grocery store and being in the fluorescent light, trying to read the labels.
Cataract is one of the most common eye conditions, affecting millions of people as they grow older. This condition occurs when the eye's normally clear lens becomes cloudy. In most cases, cataracts are a result of age-related changes in the eye. The majority of cataracts affect vision in people who are over age 60. However, some cataracts can result from trauma to the eye or from other medical conditions. Some people may be born with cataracts, or they may develop them during childhood.
Well, I'd been thinking about, why at 56 would I get a cataract? And I remembered that when I was in my 20s, I received I got hit with the ball playing racquetball in my right eye, and it hurt tremendously.
Our lenses are made mostly of water and protein. As we age, the protein in the lens may clump together and become cloudy in some areas, preventing light from passing clearly through the eye. This cloudiness of the normally clear lens is what we call a cataract. Over time, cataracts can often affect your vision in a variety of ways, causing symptoms like blurriness, poor night vision, or glare. These symptoms can gradually worsen if the cataract is not removed. Since most cataracts are part of the normal aging process, they cannot be reversed. There are no medications or eye drops that will make cataracts go away. Fortunately, your ophthalmologist can remove cataracts through surgery, restoring clear vision in most cases. Before we explore how cataracts are removed, let's learn a little about how our eyes see.
Light rays enter the eye through the clear cornea, pupil, and lens. These light rays are focused directly onto the retina, the light-sensitive tissue lining the back of the eye. The retina converts light rays into impulses sent through the optic nerve to the brain, where they are recognized as images. 70% of the eye's focusing power comes from the cornea and 30% from the lens.
As a cataract slowly begins to develop, you may not notice any changes in your vision at first. But as the cataract progresses, you may begin to find that it interferes with your daily activities. Many people say that their vision with cataracts is similar to the effect of looking through a dirty windshield.
In the healthy eye, the lens is clear and allows light rays to pass through unobstructed. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it is no longer clearly focused on the retina, causing images to appear hazy or blurred.
A cataract may not need to be removed right away if it isn't affecting your lifestyle. In some cases, simply changing your glasses prescription may improve your vision for a while. However, once you are diagnosed with a cataract, you need to keep your regularly scheduled eye appointments so your ophthalmologist can monitor your vision.
I noticed the problem with my vision over time changing dramatically, and I was in my right eye I was having blurrier and blurrier vision. I was having serious problems at night driving.
When a cataract causes bothersome vision problems that interfere with your daily activities, your ophthalmologist may advise that you have the cataract removed.
Usually with cataract surgery, a small incision is made in the eye. The front portion of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
There was a sort of a yellow in my eye when I had the cataract, and everything was blurred, and you really couldn't see colors very well. And now all of a sudden it was like a different world. You could see clearly, the colors were, intense.
The next day, I went to the doctor's office and sat in the chair, he removed the patch, and looked in the mirror, and it was totally clear. Totally clear. It was fabulous. It was very exciting.
The lens implant, called an IOL, or intraocular lens, is usually made of a flexible, foldable material and is only about 1/3 the size of a dime. Before your cataract surgery is performed, your eyes will be measured to determine the correct power of IOL for you. Just as there are different strengths or powers in eyeglasses, there are also different powers of lens implants to choose. Different types of IOL designs will affect how you see when you're not wearing eyeglasses. You and your ophthalmologist will work closely together to determine the best IOL choice for you, based upon your vision needs and objectives, as well as the health of your eyes. Before cataract surgery, your ophthalmologist will perform a thorough eye exam to make sure you're a candidate for the procedure. If the doctor finds other conditions in your eye that might prevent a good outcome, he or she may recommend that you not have cataract surgery. After surgery, it's important to follow your doctor's directions. For example, you'll need to use eye drops as prescribed, avoid rubbing your eye, and notify your doctor immediately if you experience pain or loss of vision. Cataract surgery is a common procedure performed successfully on millions of people worldwide each year. However, you should be aware that if you have another condition, such as macular degeneration, glaucoma, or diabetes, even uncomplicated cataract surgery may not give you the vision you want. As with any surgery, there are risks associated with cataract surgery. These risks, although uncommon, can include infection, bleeding inside the eye, increased pressure inside the eye, swelling of the retina, and loss of vision, either partial or complete. It is possible that months or even years after cataract surgery, a part of your lens capsule that holds the lens implant in place may gradually become hazy. When this occurs, you may notice that your vision becomes fuzzy, as if you were looking through frosted glass. Normally, this condition can be treated with a laser procedure called YAG laser capsulotomy. YAG refers to the type of laser used in this procedure. Usually, it takes only a few minutes to do the procedure and is done at the doctor's office.
Converging laser beams are aimed directly at the hazy lens capsule, and as they meet, they cut a small hole in the capsule. This allows light to pass through again, restoring your vision to the way it was not long after your cataract surgery.
Before scheduling surgery, you should discuss your vision goals with your ophthalmologist so you clearly understand what cataract surgery can and cannot do for you.
After surgery, I got new reading glasses, and it was 3 weeks after surgery that I was able to get a prescription.
It was really important for me to be able to see again, to be able to use the computer for longer than 15 minutes at a time, and it changed my life.
After cataract surgery, you may join the millions of people each year who have had their vision and quality of life improved with cataract surgery. Cataract is a common condition that over time can affect your vision. You may notice blurriness, poor night vision, or glare that gradually becomes worse if the cataracts are not removed. Fortunately, cataract surgery can help improve your vision. If your ophthalmologist has told you that you have a cataract, together you are the only ones who can decide if or when you should have surgery to remove the cataract. You will both make this decision based on your own vision needs as well as any other medical considerations. When you talk with your doctor about cataract surgery, take as much time as you wish and ask as many questions as you need to make an informed decision about having the procedure. Just remember, as with any type of surgery, you should have your questions answered before agreeing to have cataract surgery. Now, let's discuss some of the important things you should understand about cataract surgery. Generally, cataract removal is only recommended when you find you're having trouble doing things like driving, reading, or recognizing people at a distance. As your cataract develops, you may find that adjusting your glasses or contact lens prescription may be all that's needed for adequate vision. It's important to remember that your eye's own natural lens, even with a slight cataract, has some distinct advantages over any man-made lens. Cataract surgery means that the cloudy natural lens of your eye is removed during an operation. The most common way of restoring vision after removing a cataract is to permanently implant a small artificial lens in the eye, called an intraocular lens, or IOL. In most cases, the new lens is implanted during the cataract surgery. In rare cases, during surgery, your doctor may discover a condition that could negatively affect the outcome of your surgery. If so, he or she may decide not to insert the lens implant at that time. If this is the case, your doctor will talk to you about it after the surgery. It's important to understand that while cataract surgery and calculations for lens implants are precise, they are not an exact science. To get your best vision after cataract surgery, you usually need to wear eyeglasses or contact lenses for some tasks. In rare cases, an additional procedure may be necessary. As with any surgery, there are risks associated with cataract removal. As a result of either the surgery or local anesthesia injections around the eye, it's uncommon but possible that your vision could be made worse. Complications could occur days, weeks, months, or even years later. These may include bleeding, infection, double vision, droopy eyelid, uncomfortable or painful eye, elevated eye pressure called glaucoma, detachment of the retina, swelling of the retina, clouding of the cornea, retained pieces of cataract in the eye, perforation of the eye, damage to the pupil and loss of vision or even loss of the eye. Some complications may need to be treated by additional surgery. The risk of vision loss or loss of the eye is very low. However, it is important to keep your follow-up appointments with your ophthalmologist after surgery to make sure your eye is healing well. Also, be sure to contact your ophthalmologist if your vision decreases or you have increasing pain or redness. Having an artificial lens implanted in your eye carries its own risks. Complications could develop during surgery, or they could develop weeks, months, or even years later. Problems may include dislocation of the lens, increased night glare or halos, inflammation, or clouding of the cornea. There is also the risk of seeing double or ghost images, or having thinning of the iris, the colored part of the eye. In rare instances, measurements for the power of the lens may result in vision that is significantly different from what was intended. As a result, there may be a need for glasses or surgical exchange of the intraocular lens for the appropriately powered lens. While the vast majority of cataract surgeries have very good outcomes, it is important to remember that no one can guarantee the results of any kind of surgery. You may need additional treatment and/or surgery after having cataract surgery. Although it's impossible for your doctor to inform you of every potential complication that may occur with cataract surgery, he or she will aim to answer all your questions to your satisfaction.
Now that you are done watching the video regarding cataract surgery produced by the American Academy of Ophthalmology, you would need to make two important decisions if you elect to schedule cataract surgery. The first decision is which eye. We only do surgery on one eye at a time. We usually do your worst seeing eye first, although there are rare exceptions to this rule. The next decision would be the type of cataract surgery. There are two basic types of cataract surgery. There is a standard cataract surgery, which is covered by your medical insurance, where I use blades and instruments to do your procedure. There's also laser-assisted cataract surgery. This is more involved, and right now you'll watch a video regarding this new technology.
When light passes through a clear lens, the light can focus to a point, creating a clear view. Over time, the lens becomes cloudy or opaque and develops into a cataract. When light passes through a cataract, the light gets distorted, creating a blurred view. Compared to vision with a clear lens, your vision with a cataract may look fuzzy and colors might be muted. These visual disturbances from cataracts are progressive, and when they become bothersome or limit your daily activities, it's time to consider treatment. Treatment for cataracts involves removing the cataract and replacing it with an intraocular lens implant that can help restore clear vision. Many of the steps of cataract surgery that are traditionally performed using handheld tools can now be completed with a laser. Using the Catalyst Precision Laser System, your surgeon can provide you a customized, laser-precise, and gentle approach to your cataract surgery. How does the Catalyst Laser System work? Every eye has a unique size and shape. Prior to treatment, the Catalyst system scans the eye, making a precise 3D map of relevant structures. This process enables your surgeon to create a customized treatment plan that is uniquely tailored to your eye. How does laser cataract surgery with a Catalyst system compare to traditional manual surgery? In traditional cataract surgery, your surgeon uses handheld blades to create incisions in the cornea for accessing the cataract. Your surgeon will then use a surgical instrument to manually create an opening in the lens capsule that holds the cataract. With the Catalyst system, your surgeon can use the laser to make the corneal incisions with excellent precision. Moreover, your surgeon can use the laser to create the circular opening in the lens capsule with precise size, shape, and location. The goal in these steps is to make the corneal incisions precise and the opening in the lens capsule as circular as possible, in the right location and size to fit the replacement lens. With the Catalyst system, your surgeon can also soften the hard cataract and segment it into manageable pieces. Shown here is a Catalyst laser grid pattern softening the cataract. Your surgeon may recommend using the Catalyst system to create additional laser-precise incisions in the cornea. The next step in both the traditional and Catalyst laser system procedures is to remove the tissue and then break up and remove the cataract. In the traditional approach, your surgeon will insert mechanical instruments into the eye and use ultrasound energy to break up the hard cataract into pieces that are small enough to be removed. In laser cataract surgery, the softening of the lens by the Catalyst system enables your surgeon to remove the cataract in a gentle manner. For both traditional and Catalyst laser system procedures, The precision of these steps sets the stage for accurate positioning of the replacement lens. And accurate positioning of the replacement lens is one of the critical factors for achieving the desired visual outcome. Your surgeon may recommend a treatment plan that could include a specific lens implant type and additional incisions in the cornea. In traditional cataract surgery, these corneal incisions are made with a handheld blade. With the Catalyst system, your surgeon can customize these incisions for you with laser precision. These laser incisions are highlighted in blue here. What are the benefits of laser cataract surgery? With the Catalyst laser system, your surgeon can provide you with a customized treatment with advanced 3D imaging, a laser-precise treatment, and a gentle approach to surgery. To find out more about laser cataract surgery, ask your doctor if the Catalyst Precision Laser System is right for you. The Catalyst Precision Laser System is indicated for use in patients undergoing cataract surgery for removal of the crystalline lens. Intended uses in cataract surgery include anterior capsulotomy, phacofragmentation, and the creation of single-plane and multiplane arc cuts, incisions in the cornea, each of which may be performed either individually or consecutively during the same procedure. The Catalyst system should not be used if you are not a candidate for cataract surgery, have certain pre-existing corneal problems or eye implants, or if you are younger than 22 years of age. Tell your doctor about any eye-related conditions, injuries, or surgeries. Patients must be able to lie flat on their backs and motionless during the procedure. Patients must be able to tolerate local or topical anesthesia. Tell your doctor if you are taking any medications such as alpha blockers, like Flomax to treat an enlarged prostate, as these medications may affect how the doctor does the cataract surgery. Complications associated with the Catalyst system include mild broken blood vessels or redness on the white part of your eye, which may last for a few weeks. Other potential risks associated with cataract surgery may occur. These risks may include, but are not limited to, corneal swelling and/or abrasion, lens capsular tear, infection, inflammation, eye discomfort, reduced vision. Talk to your doctor regarding all the potential risks associated with these procedures. Federal law, USA, restricts this device to sale by or on the order of a physician.
Now that we have reviewed the topic of cataract surgery, we need to complete your eye exam, review our findings with you, and decide together whether or not cataract surgery is right for you.